Welcome one and all present here. Starting with the Joint Journal Club and association with Department of Orthodontics and Dentofacial Orthopedics and Department of Oral Medicine and Radiology. We, the Department of Orthodontics and Dentofacial Orthopedics, will be presenting an article titled as CBCT, the Third Eye in Orthodontics, published by Dr. Monalisa Bose et al. In Annals of RSCB 2021. RSCB stands for Romanian Society for Cell Biology. The first three authors are from the School of Dental Sciences, Sharda University, Uttar Pradesh, and the fourth author is from Seema Dental College, Rishikesh. So what does CBCT stand for? Can any one of you all tell us? Yes, CBCT stands for Cone Beam Computed Tomography. So let us understand it better by breaking it down. Cone beam means the beams that are projected onto the detectors are conical in shape. Computed meaning the different images falling on the sensor are digitally reconstructed by the computer. Finally, tomography. So what does the word tomography mean? According to Merriam-Webster Dictionary, it's a method of producing a 3D image of the internal structures of a solid object such as the human body by the observation and recording of the differences in the effects on the passage of waves of energy impinging on those structures. It is also known as stratigraphy. The main difference between CT and CBCT is the shape of the beams. The traditional CT records the data with a fan-shaped X-ray beam onto the image detectors arranged in an arc pattern around the patient, producing a single slice image per scan. Each slice has to overlap slightly in order to properly reconstruct the images. The advanced CBCT technology uses a cone-shaped X-ray beam that transmits onto a solid-state area sensor for image capture, producing the complete volume image in a single rotation. The 2D conventional radiography is hampered by various technical hindrances like magnified, distortion, superimposition, misinterpreted radiographs of the biological structures. A single 200-degree rotation over the region of interest acquires a volumetric data set. The scanning software collects the data and reconstructs it, producing what is termed a digital volume composed of three-dimensional voxels of anatomical data that can be manipulated and visualized with specialized software. 3D imaging opens the doors to accurate diagnosis and treatment planning. So we as orthodontists not only deal with the alignment of the teeth, but also with maintaining the harmony between the facial bones, muscles, and the soft tissues. The conventional radiographic techniques holds us back by giving us a 2D image of a 3D facial structure. CBCT takes us a step forward in our day-to-day diagnosis and treatment planning, along with execution of a few complicated procedures. So I'll give you an example. Like in many of my own and my batchmates' cases, I've noticed that the treatment plan with conventional radiographs was completely different from after the CBCT evaluation. It is surprising that the little details added by the CBCT image can provide vital information which can change the course of the orthodontic treatment completely. And also, this information helps us in better risk assessment to keep the patient well informed about the planned procedure. Now let us look one by one in detail how CBCT is helping us. Impacted means that a tooth either has not come in when expected or a tooth that cannot erupt because it does not have room or maybe coming in wrong direction or position. CBCT imaging in orthodontics is most commonly indicated for the evaluation of an impacted tooth position. CBCT imaging gives us a more accurate information to determine the location and placement of the teeth and the stages of development to decipher the precise angulation of the impacted teeth and its proximity to adjacent structures. To explain this better, let us look at this case report here. This patient reported with a missing central incisor and canine. First, a clinical examination was done, followed by conventional radiographic examination, which involved the OPG, IOPA, and the lateral cephalogram. As we can see that these radiographic images do not give us enough information about the impacted teeth and hence might leave an orthodontist puzzled about how to proceed further in such a situation. After looking at the CBCT images, it is quite clear about the location of these teeth, and hence it becomes easier to move further with the treatment planning. Orthodontic traction of the teeth was planned. The canine was successfully brought into the arch, whereas the incisor later was prosthetically replaced because traction of the incisor was not deemed of having a nice prognosis. CBCT not only provides details but also accuracy of the location of the structures. If the CBCT volume is collimated to the impacted tooth, the benefit-risk ratio is considered favorable. Root resorption is a very commonly noticed during orthodontic treatment. Here is a case report in which radiographs of an 11-year-old girl with a class 1 malocclusion and moderate crowding in the mixed dentition stage showed that both the maxillary canines were impacted. The right maxillary canine was impacted palatally and the left one buccally. The root of the left central incisor showed clear signs of marked apical root resorption caused by the impacted canines. The maxillary left canine was surgically exposed and orthodontically moved away from the incisors in an attempt to save all the 4 anterior teeth. 11 months later, a new radiograph showed marked resorption of the lateral incisor roots. As a consequence, both the maxillary lateral incisors were to be extracted. Moving on to cleaved roots. So cleaved roots in an oblique direction may be difficult to view radiographically. CBCT techniques can show the concerned tooth in all 3 planes of space. With CBCT, the exact location of root fracture and the angulation of displacement can be established. Here we can see in a different pictures like how the IOP is not giving accurate information, whereas the CBCT gives us a very accurate information about the cleavage of the roots. Again, in this picture, we see the same, that the IOP doesn't give us enough information, whereas the CBCT image evaluation helps us much better determination of the cleaved roots. Orthodontic implant placement. In CBCT can be extremely useful tool for the placement of orthodontic implants. It can be mini implants, IZCs, or buccal shelf implants. This case report shows how an implant placement was planned using CBCT, and then an implant placement guide was fabricated, which was first tried onto a model, and then later the implant placement was done. The implant placement was evaluated again by the CBCT, and it was seen that the placement was quite accurate. Site of anatomic structures. CBCT imaging gives us a precise information about the anatomical framework in all the 3 planes. It also provides an accurate measurement of area, distance, and volume of the anatomical structures that aids the orthodontists to come up with a better treatment plan. Several studies have indicated that the CBCT scans provide a better cephalometric measurement in contrast to a conventional cephalogram. Furthermore, the conventional cephalogram is barred to represent the 3-dimensional structures onto a 2-dimensional plane. CBCT-generated cephalograms are more beneficial as compared to the conventional radiographs in recognizing the bilateral landmarks such as the gonion, condylion, and the orbitale, as they are often superimposed in conventional cephalograms. Asymmetry evaluation. Landmarks in 1 or 2 planes of space can be easily identified, but identifying landmarks in the 3rd plane is challenging, but it is achievable by the CBCT. CBCT holds us the following advantages in landmark identification. Firstly being the lack of superimposed structures. Secondly, image produced that are not plagued by geometric distortion. And lastly, it facilitates easy visualization. This can be taken a step further by incorporating the CBCT in the surgical planning. For example, this picture shows the displaced segments which need to be surgically repositioned to correct the facial asymmetry. TMG assessment. CBCT provides diagnostic accuracy and reliability for the evaluation of osseous TMG abnormalities. In 2005, the first study titled as Accuracy of Linear Temporomandibular Joint Measurements with Cone Beam Computed Tomography and Digital Cephalometric Radiography by Michael et al. Was published, showing that CBCT can produce TMG dimensions of accurate and reliable measurements. The bone morphology of mandibular condyles can be easily traced or detected by the CBCT images. CBCT is also useful in detecting the bone diseases such as juvenile idiopathic arthritis, condylar hyperplasia, and many other joint-related diseases. CBCT is considered the supreme method to render visualization of many anatomic variations.